Hello everyone. I hope everyone is doing well, enjoying the winters. That's the season and that's the few, I would say, weeks of cold and all around here. Well, as I say that I usually like to talk about cases where we have challenges and challenges are, a part and parcel of the profession. So a lot of times you're only looking for aesthetics and showing brighter, nicer teeth, but I think holistically treating patients is becoming something challenging, and I feel that when you treating a patient, especially with complete full mouth, the way we call it, the complete jaws, whether it's implant based or whether it's the natural tooth you retain, it's all about a very good plan. It's about understanding your patients and the challenges, and at the same time, one should be able to explain those challenges to your patient. It's always a two-way communication, which I feel there have been times which even if I look back 10 years, 15 years, we feel, we were jumping into more conclusions faster than actual needs. We were maybe looking at more aesthetics. If we were looking at function, we were looking at numbers, when you're placing 5 implants, 10 implants, 12 implants. So I think slowly when you have your experiences, as you grow professionally, as you, learn more from various ways of your education, and the biggest learning is your patients, by end of the day is what I feel. And there are instances where you get very, very challenging patients, and today I have one of them, Mr. Satbir Singh. Well, I think first I should compliment him for the fact that he's been very cooperative with a lot of things which sometimes is difficult for the patients to understand. He's been also very, very, I would say, understanding about the kind of intensity and the problems he had. And I'm very happy sitting here today to be able to give him entire teeth, his full mouth smile, and that by that I mean more of function. Here the challenge was functional, here the challenge was understanding the entire biology, understanding the entire biomechanics, understanding how the occlusion, the way we call it in scientific way, or how your teeth meet, how your joint is behaving, how the entire musculature acts in a certain way where you put or the patient gets into issues which are even difficult to diagnose. And if we give straight away some short form of teeth or just try to without understanding or doing some test drives like temporary phase, and so this was done in a lot of phases, and as I said, it has taken us quite a bit of time, and especially with the COVID coming in between. Yes, it took us a couple of years to be where we are, and we feel proud of the fact that we have been slow but very sorted. Everything has worked according to the plan. And I also want to say here that kindly understand science as totally not just one factor over the other. The further success of such treatments, when we talk, also depends on a lot of maintenance, a lot of follow-ups, understanding how this will go over time. And this is what I'm working on, to talk about cases where we did about a few years and how do they feel at this point. So we've been in touch with each other about 2 years or more now. And that's where you get some confidence of saying where we started, where we are, and how we are progressing. And I would request each one of you to kindly not take dentistry as a one-stop solution and a solution forever, even if you have a single crown, or you're having a bigger smile makeover, or you're having a bigger full mouth rehabilitations, the way we call it, where you have implants, teeth, and you get all your 24, 28 teeth, whatever. So please don't take this for granted that this would not fail or there won't be challenges. Rather, understand your challenges, understand the future perspective, how those things or what will be the backup plans and solutions. And here we come handy, where we have been coming up, or we thought of all the backup plans, and we still know where we should go even if there are challenges. So when you have these kind of things sorted in a treatment plan in a sequential way, where you chart yourself, where you explain the patient how things are, how things will be, I think that's the way ahead, which we've been talking not now but since years. So I think it's been more of a thoughtful, I would say, things I said which I feel are serious, because I want each one of you to see the patient in a bigger sense. Kindly see the tongue, kindly see the cheeks, kindly see all other tissues, kindly see how a small ulcer can misbehave and lead to issues. Not just work on cleaning and giving crowns and caps and veneers, because I feel it should be a complete balance of function, aesthetics, and the entire personality of a person, along with his lifestyle, his medical background. So all these things have to come together to have good results, and that's something which I've been working on since years, and I'm getting more and more confident once we are taking those kind of approaches with our patients. So having said it all, I would rather ask Mr. Satbeer to say a few words, so that we have our confidence going better, and understanding that the kind of challenges he had from and the way he could not get his job done, and when he got it done everything went wrong. Yes, there were challenges. You can't blame anybody for a certain way, because it takes a while for the patient or for us to understand how the whole thing works. So yes, he has parafunction, bruxism, and those kind of things which sometimes are impossible to control. But there are ways where we at least are able to come to a point where we feel yes, we have the balance, and see how well it goes and how things go. So over to Mr. Satbeer.
Hello everyone. So finally today, the long 2-year journey ends, and from where we started and where I am today, and it's night and day. Two factors, the most important factors. One was, of course, function, and the other looks. They were both bad when I came. Took us a while because of certain factors which were beyond our control. But Dr. Malik and his team, they were very patient with me, and the treatment was totally professional. I can feel, being from engineering background, the way the bite is, we're dealing in tolerances of microns, and what I have right now is nothing short of amazing. So for that, I'm very thankful to Dr. Malik and his entire team. Total professional experience. I couldn't have asked for a better environment and a better product. The way it was designed and manufactured and installed very meticulously. So one more time, thank you so very much. Appreciate it. And God bless all.
Thank you, Mr. Satbeer. So again, I would say it's more of confidence building. So where again I want to put stress on the fact that with the good technology, all the digital workflows again we followed in his case, and the kind of artificial intelligence we had in our machines, sorry, we've been able to do a lot of analysis, understanding the entire bite, the whole way it should happen, and also a lot of material science beyond just the fact that yes, you're putting implants. We try to save a lot of natural teeth. We had a lot of backup on that, and which is still, it's a mix and match. But as I said, technology, infrastructure are an integral part. But guys, skills is something we should all keep, polishing ourselves and start understanding ways and things where we can do better. So everybody of us is learning, so am I, and cases like this are always a good experience. Thank you so much.